So, good morning, guys. We're going to start with washing your hands. Every process we do starts with a good hand washing, right? Then we're going to look at the equipment for starting an IV. In this case, many of your facilities are going to come with packets that have several things in them. In this case, you guys have a loop of tubing and an extension tubing. Many of them just call them a J loop or a J loop. I didn't do that the right direction because J would that would be a cane, wouldn't it?
A candy cane.
A candy cane, and this would be a J loop. Either way, depends on which way you turn it, but something like that. A sterile IV cover. So this says sterile. It is the whole process that we've taught you 100,000 times of making sure that it isn't touched and sterile and make it relax. It's fine inside the package. You can open it. You can touch the outside of it. It's not that serious. Most of them come with some sort of a 2x2. They're usually not even in a package like this because it's all packaged up. And this isn't even in a package either. And the package that the facilities ones come in are also, once you open it, that's it. They're not sterile either. So it's just open to get to the products you need. You got a little 2x2. You've got your cover that's going to go over your IV site once it's done. The inside's still all protected, so you're not hurting anything by touching it. You've got the J loop, or in our case here today, and in your packs are extension tubing. Dun, dun, dun. Throw away what you don't need, not that big a deal. Now in this case, there is always a lure lock. You've seen that on your other IV tubing. The lure lock, just get rid of it. Attach, then your flush. Did I do that backwards? I did that backwards because it goes on the other end. This is still okay. Put it back on, Barbara. See? Little mistakes. But they're fixable. Nobody was hurt. Did it the other way. Screw it on, lure lock. Then I'm going to push the fluid because I want this tubing to be filled with the liquid, the sodium chloride, the normal saline, and not air. Right. There we go. See a little drips? We're good. Leave it in here. That's fine too. And making sure then too, what we're going to check is the IV intrasite or whatever they call it, but it's going to be your catheter and needle. The needle then of course comes out. Everybody goes, so the needle's left in my arm. The needle is never left in your patient's arm. It is the needle covered with a plastic catheter. Slide it in, you pull the needle out. It's all flexible and bendable. They come in different forms. These are just two of the many forms they come in, and they're all color coded. In this case, blue is a 22 gauge. You'll see that green would be a 20, pink would be an 18. So they get bigger as the number gets smaller. So the diameter or the lumen would be just a little bit different. We're using a 22 in your kits, and that's fine too. Just prepping all of our supplies so that when we're ready to go, it's all open for us. Most kits also come with a, tell me what the name of this is. There you go, guys, you did it. It is a tourniquet. And tourniquets can have really fantastic uses outside of the hospital, but don't take them home after you use them on a patient. You know that crazy pickle jar you're having a hard time opening at home? There you go. You wrap that around, tighten it up. But for the patient, what we're doing here today is the tourniquet to give us a good place where there's good venous return. We see their veins starting to bubble up and getting bigger. We'll be able to see it better. In my practice, I've always found that it's a good idea to have a little bit of tubing, a little bit of tape prepared to take my tubing to my patient. Not all facilities and schools will teach you that you must have the tape out or you don't have to have the tape out. I do find that having a little bit of tape is good so that if it gets a little jostly, I can at least set something there for my patient. Should be out of the way, not in anything that's going to be touched by a lot of things. It can hang off the edge of a table if you need to. In this case, we're going to use this, but it's just a little bit of tape so that you have some support before you put down your cover. And sometimes the tubing farther out needs a little bit of stability. So just setting it out of the way for now. Equipment wise. The next thing I would make sure I would do before I'd check my patient, I'd come up and take this tourniquet. We're pretending that his arm and his head connect to his body way up that direction. So here we go. We're going to set it on, wrap it around, and tuck under at the top, just a little tuck. So there's always this little piece sticking up. That is a fast release because right now this patient's blood is beginning to back up. It's getting bigger and bigger. If we left that tourniquet on for a period of time, more longer than we needed to for just this process, we could blow their vein in some way, damage it, and or then cause restriction farther up. A blood clot could even come from that. So here we are, we've checked our patient, and this guy's got a really fantastic vein. You can kind of see it in this case because here's the tube at one end, here's at the other. You never have that on a person, but it's right along here. You can't see it, but I can certainly feel there's a little bit of give here. So now that I've known that's where it is, I go ahead and release it because I know where I'm headed. The other thing that would come in everybody's packet is some sort of an alcohol test swab or a ChloraPrep. I'm going to open your ChloraPrep here in this case, and I want you to be able to hear what it's supposed to do when it's ready. Listen. You heard that click. There's a little cylinder or a cassette of fluid that just breaks right in here. So when it does that, and you've got it set on the side, you can see where it's starting to get damp. I can put it on my skin, and I'm putting it on my skin here because our fancy man over here, this skin, our fake skin, won't take it. So we'll be needing you to verbalize that you're prepping the skin with either this alcohol or ChloraPrep. But it is damp, and it would be on our skin and give us a good clean area and be able to see the vein better. Something else that people often do when they're talking about starting veins or starting IVs in somebody's vein, you'll see people like hit right after they've put stuff down before they have prepped it in any way. Before they've prepped, they're looking to see where's the good vein, and you'll see people hit. Hit is really going to defeat your purpose. When you've been hit, did you stand up again? No. If you've ever seen somebody to get hit, did they stand up? No. Now I'm going to take you down a road that you guys are comfortable with me, but be careful. In your lifetime, you have probably never seen something get hit and then fill with blood, but you have probably seen something get rubbed and then fill with blood. So if you're trying to find a good vein, you're going to have better luck by rubbing along your vein than you will by hitting it, because it will then get more engorged in that area. And that's okay. So if you see somebody hitting on it, let them have their own problems with it, because it's not going to do it a whole lot better. But maybe on the side later go, maybe you want to try rubbing and see if they get a better result. You're going to be having a better result all along because you're just going to kind of rub along that vein and get a better flow. So here we go. We've checked where the site is. We've prepped the site with ChloraPrep or alcohol. We've got all of our equipment out. We're going to wash our hands again, because before you put on gloves and after you take off gloves, in every process they've said, what do you got to do? Hands. So here we go. Michelle got me these really great gloves, and turns out that each one was a different size. So I thought, heck, let's have one in each hand, so that might help with a visual left and right. So you can tell that the pink one is a little bit smaller. That's okay. So I've got my gloves on because now it's time to go ahead and get everything open, or get everything going. I will not blow after I have cleansed, because what am I going to do? Blow but my own nasty breath. I'm just saying. But I could maybe wave. Should I wave? Probably not that either. What am I going to do? Let it dry. Okay? Let it dry. Now, the patient's going to have some strength in every case to hold their own arm down. Let us pray. But in this case, you'll see Michelle's hands come in and hold this patient's arm down for me. Oh, on the other hand, just pretend that her strength is doing this and we're not having to touch all over this place where we've just prepped, right? If you ever need to prep a little more, that can also be done. It's not like this was so special that it's worn out all of its goodness, you could prep again if you needed to, or if you felt like it wasn't quite right. Dun dun dun. Here. See, now we always check too that the catheter is not stuck for any reason to the needle. So I've just turned it around and I put it back up. You can see too that there's a little place along here to push your finger to have it go and slide on in, okay? That would be the top. You can go back and find where you, I wish I could see better. These veins don't stick out in color very nicely. But I'm not gonna go then and poke myself. I'm gonna try to stay below. And find where he is. And we prepped up here. Pretty sure it's still right there.
It's kind of thick skin too, so.
Let us pray, guys. Here we go. On the other end. Does he have blood flow?
He does have blood flow. It's a little deeper than you'd expect normally, because the skin's a little thick and there's some foam below it.
There we go. You see that flow come back in? That would be the blood. And then you just slide the catheter. This would be a good time to go ahead and stop the tightness. Hold here, press the button, and you see it's starting to pop. This would be a good place for that. And hurrying up, because you don't want him to continue to bleed a whole lot. I didn't loosen this.
Do you need me to?
Well, I shouldn't need you to, but
I've stopped his blood flow.
thanks, you're the best. Connect, flush. Now his blood is going back.
I wouldn't
That's-
flush too much.
Yeah, that's good. I'll clean that guy. And that little bit of tape that I wanted to just keep here to stabilize. There's often you could use whatever to kind of clean up the skin if there's more 2x2s or 4x4s nearby. Or in this case, because this is not a real person, our fancy dancy Kleenex. Don't use this at home, just saying.
Well, they won't be doing this at home because they can't start IVs on other people.
Oh, what she said. All right. I don't need that anymore, and all this is going to do is stick to me anyway. And peel back to cover. The risk of blood contamination now is low because it's all encased. Just peel back.
It does.
It does.
Peels off.
Got it. I thought it was going to be harder than that. What do I know? It's going. And at this point, you can see too. You can see too that I haven't disconnected here, and I'm ready to set up my patient's IV flow. We've already got tubing set up and flushed all the way through. So here's fluid in the drip chamber. No air in my tubing. That's already been checked. I was prepared to do that. Woo, swinging around. And you see at the end that it's been capped and covered, so it's safe. Unscrew. And since this has remained covered, it's remained clean. Connect, connect. And it started to come back because, hey, this flow is stronger than when I disconnected for a second. Now I can open this for the flow to begin for here and open this, the roller clamp, and gravity should begin to start making that flow. But right now it is the same height. So we're going to get up a little higher. And gravity should be telling
it's going.
us it's going.
It's going.
Okay. I'm going to hang that back at the same level. And the last step in any one of these, anytime you're taking care of, you know, any process or whatever, is to make sure that you clean up your mess afterwards. So I would then take all of my products that I didn't use or I don't need or in, oops, did I just do that? Did you let me do that?
What did I do? What did I watch you do?
Maybe you didn't.
No, it's
Oh,
in
it's
there.
here. Whew. This guy is the one that absolutely has to be saved and go into your sharps container. That can go in your trash because it didn't get anything else on it either. That goes trash. That goes trash. That goes trash. All these wonderful things. I'm going to touch this. While this is saturated, it's not enough blood for any of your facilities to say this has to go into a biohazard container. All of that, we didn't use this. We can use this another time. And if we felt like at this point any part of this tubing was wobbly, we could use another little piece of tape to give it some support. Clean up our